On behalf of the Community Technical Assistance Center of New York, it is my pleasure to welcome you to this informational webinar on the Knowledge Empowers You learning community. My name is Jim Rodriguez, and I'm a senior research scientist at the McSilver Institute and director of Trauma and Resilience-Informed Services at the Community Technical Assistance Center of New York. A little bit about myself. I'm a New York State licensed psychologist and social worker, and I've worked for over 25 years in research, training, and also as a clinician, primarily in the area of children's mental health, with a deep interest in trauma treatment and trauma-informed care. And I'm also currently in private practice. I'll be coordinating the learning community, but KEY is the brainchild of Dr. Anthony Salerno, and Dr. Salerno is having a problem calling in unless is Tony on? Okay, so actually, when he joins us, he'll be able to speak a little bit to KEY and talk a little bit more about the background on KEY. But I just want to move on to our agenda for today. We're going to talk a little bit about what KEY is, give you a little bit of background on its development and where it came from. And I believe we have Dr. Salerno on. And so we're also going to talk about the goals of KEY and what we think are the anticipated benefits of KEY. We're going to give you an overview of the workbook that's the centerpiece of the KEY program. And then we're going to talk about the Learning Collaborative, what it is, and how to join. And then we'll have question and answer at the end. Tony, are you on?
Can you hear me?
Yep. Okay. So great. So actually, that's perfect, Tony, because you came in just in time. So basically, so I just want to say a little bit about Tony. He is the Institute's Innovation and Implementation Officer. Tony has over 30 years of experience in public mental health, and he was the developer of the wellness self-management approach. Many folks are aware of it. Many of you may have used it. And that wellness self-management work and that curriculum-based program is in many ways the progenitor of the KEY program. And with that said, I'd like to turn it over to KEY and have Tony talk a little bit about the background and what KEY is.
Yeah, thanks so much, Jim. And it's really a pleasure for me to be on this webinar, and also to see that there's such a large interest among folks in the state to learn a little bit more about a resource that was really designed to help you. And in helping you, meaning a tool that could be practical, that really builds on what we view as some of the best practices in group facilitation and also adolescent and young adult learning. So much of this recognizes that in your work, and I was actually a former high school teacher and guidance counselor before being a psychologist and working primarily in adult services for like over 30 years. But the challenge is in engaging young people and assisting them to begin to thoughtfully reflect upon the decisions that they're making and that they need to make as part of their just developmental process. And we know that it's not so easy to do that. And the idea behind KEY really is to see if we could provide a practical tool based upon adult and young adult learning and education that would be a resource that's very practical for you to use, and that would be meaningful to the young people that you work with. So, we've done a number of pilots on the KEY program. We've gotten feedback from young people. So this begins to reflect another iteration of a product that has had the experience of people that it's designed to support, and they're providing that kind of feedback. So, and as if you decide to be engaged in this, one of the things that we would want very much from all of you is to not see yourselves, you're not like subjects in some kind of research project of ours, or that somehow we are, trying to get you to do this exactly as it's been designed, but rather that you are joining us as partners, as professionals in really developing, increasingly developing, this kind of product that would be most useful. And your knowledge, your expertise, your experience with this is a very instrumental part of it. So I'm very, very pleased that so many folks are interested. and we hope that many of you decide to join. And I think you will find it a meaningful and worthwhile experience for all. So thanks very much. Okay, Jim?
Thanks, Tony. And so a little bit about KEY, I think as Dr. Solano has mentioned, it is a curriculum-based group intervention. It's designed for transition age youth in the range from 16 to 25, and it's focused on helping them to recognize their strengths, making informed decisions about important areas of their lives, and we'll go into more detail about what we mean by that, and to increase self-efficacy. It's a psychoeducational group. That is, we provide information to young people and let them make decisions about how and even whether they're going to use that information. We consider it an adjunctive intervention, and what we mean by that is that, and we'll talk about some inclusion criteria later, but one of the things that we feel strongly is that this works in collaboration with or integrated with other care that the young people may be in. We focus on young people who have been in the mental health care system or are currently receiving mental health services, so it works adjunctively for young people who are either in individual therapy or medication management or some combination of the two. And we've done a lot of work, as Tony mentioned. We've done previous learning communities on this. We've made some significant changes to it to align it more with trauma-informed and resilience-building approaches. One of the things that I want to say that KEY is not, and this goes back to something that Tony said, it is not a stepwise manualized approach. And so as Tony said, we don't look at this as a typical evidence-based treatment that has been developed in the lab. In many ways, our lab is the community and real-world setting like your settings, the places that you work, where we explore and examine the effectiveness and how to implement this and how to adapt it and improve it. So a few details about KEY. The workbook, as Tony mentioned, aligns with some important competencies. We try to integrate into the workbook competencies and structures and activities that are based on motivational interviewing techniques, educational techniques, and cognitive behavioral strategies. And we also will outline for those who come to the training a very simple facilitation model that we find is practical and highly effective in applying it to KEY as well as other groups that folks may run. And these competencies are embedded within the workbook. So the workbook in many ways is self-contained. You can adapt, you can add, but it is self-contained. Our hope is that as you implement the workbook, you have everything that you need to conduct a KEY group. And then why is it important? Well, so we know that youth with mental health problems often struggle with the transition from moving from child services, whether that's child mental health services or child foster care services, into adult services. And in that transition, they can face increased risk for dropping out of high school, having problems with the justice system, substance abuse, and early pregnancy. And as we also know, they're also at increased risk for dropping out or losing necessary services. And this population is also less likely to attend and attain college degrees and be employed. But one of the things that we believe strongly is that transition-age youth are also in the middle of significant changes in how they make decisions that are in line with KEY, so that we're hoping in many ways that we can turn at-riskness into opportunity for young people to make decisions based on the information we provide and based on some of the strategies that we use to allow them to guide and make their own decisions. The delivery of the KEY program, again, it's workbook-based, but it's a group format. We expect the folks to meet once a week for 45 to 60 minutes. Optimally, it's a closed group with 8 to 10 members, but open groups are feasible and possible. We can discuss that as we move along in the learning community. And optimally co-led by 2 facilitators. And the length of time, so as you'll see, there's quite a bit of information. There are 26 sessions in whole, and However, the frequency and the amount of time can vary in according to, obviously, the frequency and pace of meetings. So sessions that are built to or designed to be 45 to 60 minutes may go long, may go short. And then, so we also consider critically important clinical decision-making, so professional judgment in terms of how and how much to go into every session is we leave up to clinicians to make. There may be, we also realize there may be program limits, residential stays may be shortened. We see them lasting approximately 6 months. As we move through the program, if a program is unable to complete the entire curriculum, we can provide guidance on how to engage the participants in selecting the parts of the curriculum that are most important or most meet the felt needs of the participants in the group. And some of the goals of KEY for transition age youth. We focus on increasing their confidence and skills in thinking through the choices they make. We try to help them understand how negative thinking gets in the way of making decisions, how to make the best use of the resources they have and the supports they have in their lives, and how to understand and know their strengths and understand how those strengths can help them make decisions. And then, of course, very directly to make informed decisions about work and school, intimate relationships, friends, family, and how to manage stress. We also see some really important benefits for clinicians. The workbook is designed to have all the information you need, as I mentioned earlier. It includes the information that you'll be imparting to the young people, self-assessments, and both the participants and the facilitators of the group will be given the workbooks and will be working through the information and the material together. And in that sense, it supports and guides that those motivational interviewing techniques and cognitive behavioral techniques throughout the workbook and the implementation of the workbook. We hope it's a user-friendly curriculum and provides all the material that you might need. And you can certainly add to and adapt, which actually we encourage, and we'll provide some tools to help, and I'll talk a little bit about that later, but you don't need to. You can use the workbook as is, and as I said, though, you can add to it, adapt to it as we move along. And in fact, as we move along in the learning community, we'll be asking for and having you think about what those adaptations might look like to improve the overall program. And so it is in many ways a work in progress, and that's why we're using the learning community format to implement it. And then for organizations, some of the benefits for organizations, again, it provides a practical vehicle to promote recovery-oriented, person-centered, and trauma-informed services for transition age youth. It supports staff development for core clinical competencies, as we talked about, some of the group facilitation skills that we'll teach folks and share with folks. It's inexpensive and easily accessible. And I should sort of note with that, for the learning community, we will have workbooks available. If an organization decides to adopt KEY as a program and approach that they will continue to use in the future, workbooks may be up to you. But for the learning community, we'll provide as many supports as we can. And then in many ways, the workbook, because of the way it's designed and some of the sessions that we have and the material that we have, it is consistent with criteria for medical necessity. In other words, you can bill for participation in KEY groups. Tony, I want to bring you in. Again, anything that you want to add so far?
No, I think this is really explaining it, pretty well. The only piece I would want to sort of like add is you've been making as Jim has been emphasizing, unlike approaches of some of the evidence-based practices, which, you have to adhere very, very closely to a certain set of like interactions and implementation strategies, we sort of recognize that we have to make adaptations, that we have to be very flexible, that based upon the response of the young people that you're working with, you begin to make some adaptations to it. we just recognize in the complexity of the work that you do with humans, the idea that there's sort of a rigid, step-by-step approach to take, but we don't see that as really, reflecting the realities of the work with individuals, especially young people, with the kind of complexities that they bring. And so that piece that Dr. Rodriguez has been mentioning about if you have an idea or an approach that you think would actually, that your group would respond better to it than what's actually being laid out in the workbook, never feel constrained by the workbook. It's not supposed to trap you in or have you feel that's a rigid kind of an approach, but rather it gives you a good baseline foundation, and then you can build from that and use your own experience and knowledge of the young people you're working with to make some of those adaptations. And what we look forward to is learning about that. What kinds of things have you done that you found was really helpful? We are very open to taking those ideas and thinking of the next iteration of KEY. And so that's the way we see this process, and I think it's an important concept that Dr. Rodriguez mentioned over and over. Great. Thank you, Jim.
Great. Thank you, Tony. So let's walk through a little bit of an overview of what's in the workbook. So the workbook is divided into 7 sections and includes 26 sessions. Section 1 is designed to lay out the foundation for the program. In Section 1, that includes 4 sessions, we talk about, of course, the program, the goals of the program, but we also talk about safety in the context of groups. Again, as I said, we integrated trauma-informed principles. For those, who are aware of trauma-informed care, safety is a critical feature and a critical component of trauma-informed care. So we talk about safety, and we talk about building safety in groups. And then we talk about goals, of course, how to set goals and what gets in the way of folks reaching goals, and helping young people identify the things that get in the way, and ways of addressing those barriers to reaching goals. And then we talk about strengths and guide the young folks through a process of identifying their strengths. So what we think is critically important, as I said, is in the manual, in the workbook, we clearly sort of lay out a discussion about resilience, and we talk about resilience and teach folks what resilience means, and then how to develop it and how it develops in context. In Section 2, we deal directly, as I said, Section 1 is in many ways intended to set the stage for Section 2, wherein we address dealing with stress and adversity and how to build resilience. So in Session 5, we talk very directly about trauma, adversity, and toxic stress. We inform young people about what those are and what can help overcome them. And then we quickly turn to some of the ways in which young people can cope, deciding how to cope with stress. What are some of the strategies that they use? We try to provide some ideas and checklists of things that they can identify and ways that they can identify to cope. How to build self-confidence. We talk about thoughts and thinking and positive and negative thoughts and how they impact decision-making. And we end that section on exploring social identity, helping young people identify their identity, their self, and looking at ways in which their social identity and social status can also impact their decisions. And we also talk about values and help them and guide them through the process of identifying what values guide the decisions that they make in life. And then in Section 3, we cover relationships, different types of relationships. We talk about friendships, but we also talk about intimate relationships. Making informed decisions about those, about intimate relationships, and then also family relationships, how to understand them, how to heal in some cases, and work through them. And then in Section 4, we address ways in which young people can develop healthy lifestyle practices, so just helping them to decide what steps to take to develop healthier lifestyles. We talk about exercise, diet, and mental health. And then we also talk about using treatment services in a way that works for them. That includes asking questions, knowing their diagnoses, and how to advocate for themselves for services, and of course, how to maintain and continue receiving services that are needed. And then in Section 5, we cover quite a bit in the area of mental health. Again, we return to the topic of strengths. We address other ways of developing mental health and emotional well-being, how to get the most out of their mental health care. We return to that topic. And then we talk about drugs and alcohol and how they may affect physical and emotional health. We try to, and this is one of those areas where we try to take a harm reduction approach. We do provide information about the impact of alcohol and substances, but in many ways we integrate motivational interviewing strategies into this section, so we allow them to make decisions for themselves, examine for them reasons for and reasons against using, and what impact it might have. We let them make the decisions about themselves. We try not to preach, but we do provide information. And then again, we return to coping with stress once again in the context of mental health services. And then in Section 6, we cover work and school, helping them make decisions about either looking at careers or work, returning to school or staying in school, and how to make informed decisions in those areas of their lives. And then the last section is wrap-up, reviewing their progress in KEY, and thinking about what next steps they might take in their lives. So we want to stop there and give this quick poll question. So for those of you who are participating, up until this point, we've covered some of the topics that we've covered. So this poll question, how important are these topics in addressing the needs of transition-age youth? So from your perspective, for those of you who are on the call, please indicate very important, important, somewhat important, not very important. Do these topics seem in line with your views about what transition-age youth need to know and what's helpful to them? So take a minute to okay, great. So, so from the results of the poll, the vast majority of folks do agree that these are very important topics, and the remaining folks either find it important. The majority of folks find it very important. The overwhelming majority of folks find it very important. And then there are a number of people who weren't able to answer who might not be on the call. So these topics do appear to make sense to folks. So moving along, a little bit of the format of the session. So, of course, we have the workbooks that have the content that we think is important to cover, the areas that we think are important to cover with young people. But there's also a format to each session. So each week's session is divided into three major parts. There's an opening discussion of the topic, trying to understand from the participants' perspective what the topic means to them, what experiences they may have had with the topic or in that area in their lives. And then we provide the important information. What is it? We go in depth about the topic, why it's important to discuss this topic. And then each of the sessions also has a process of personalized self-assessment that we have them complete. Actually, I should say most of the sessions have that, with few exceptions. Most of the sessions have some personalized self-assessment where they're able to examine themselves with regard to that area. And then we end with action steps, or give them the opportunity to identify a goal or an action step that they might take with regards to changes they'd like to make in that area of their life. Again, as we mentioned earlier, we leave the decision of whether to identify a goal up to them, but we provide them the information and the time and space to think about what action steps might be. I want to take a quick moment to just give folks an idea of what the manual, the workbook looks like. So this is the workbook, and after a little bit of a preamble and some additional information, we have the table of contents here. And then just to give folks a quick idea of what a typical session might look like in the welcoming session, so welcome to KEY, the Knowledge Empowers You program. We talk about decision making, so we open it up to discussions. And of course, in the first session, we cover what KEY is, and we provide them some information about KEY and what's included. But also we talk about the importance of decision making and decisions they've made in their lives. We have them reflect on why KEY might be important for them, why KEY might be right for them, and then what KEY is not. And then we provide some ideas about how they get the most out of KEY. And then this is an example of a self-assessment. So the check yourself here is on decision-making strengths. What strengths do they have related to decision-making that allow them to think about things that they might already do with regards to decision-making specifically, and things that they'd like to work on with regards to decision. And then we identify or give them the opportunity to identify some action steps and or express themselves with regard to the topic in general. So that's an example of a session, getting to know each other and creating a safe space. Again, we talk about safety in groups, and the importance of safety and why it's critically important. And then also we talk a little bit about some of the difficulties that young people might have getting to know each other. So these are some typical examples of some sessions that we have. Again, some of the difficulties or some of the strengths they have with regards to getting to know each other, and some areas that they might want to work on. So that's a little bit of the workbook and a little bit of the process. The materials that you'll be provided as participants in the learning community include, of course, the workbooks for participants and facilitators. And then we've developed a facilitator guide, or I should say facilitator guides. One of them includes a very simple, at-a-glance group facilitation guide that gives you a very clear understanding of some processes with regards to group facilitation that are just reminders of the strategies that we strongly recommend following in terms of running groups. Then in the facilitator guide, we also have a protocol for a pre-group interview, a readiness to participate interview. One of the things that we talk about with KEY is that pre-group interview is critically important to increasing motivation and readiness to participate in KEY. So part of the program is conducting those pre-group interviews. We also have some ideas in there about recruitment and how to identify and get what we call nominations. We don't talk about referrals. We try to use as much destigmatizing language. So getting nominations from folks for young people who might be a good match for KEY. And then in addition to that, we have in the facilitator's guide additional group activities that can be used to promote engagement, icebreaker activities, energizer activities, some mindfulness activities that you can use. Again, as we've mentioned already, as Dr. Salerno and I have mentioned, it's not a manualized approach. Oftentimes in manualized approaches, all of those kinds of activities are baked into the manual, and you're expected to utilize all the activities activities or implement all the activities as directed in the manual. We give you the facilitator guide so that if you need some of those additional activities to promote engagement, they're there for you to use, but you can use them as you see fit. And then in addition to that, also in the facilitator guide, we have a few of the measures. So as Dr. Salerno mentioned, we are going to be getting information to evaluate the KEY project, the implementation of KEY. And so we have built into the facilitator guide an easy way for you to track participation, attendance, if young people discontinue, those things as well, and a very simple fidelity check with regards to KEY. Again, fidelity in quotes because we don't necessarily expect to follow everything in lockstep, but fidelity with regards to our facilitation model. And a few things about the KEY approach. In addition to, as I said, the facilitation skills that we plan on teaching, in general, some things that we believe are critically important. We do believe that the KEY approach is trauma-informed and resilience building. In the training, we'll talk a lot more about what that means, but in many ways, it's consistent with person-centered, recovery-oriented care. That includes things like partnering with participants in care, collaborating with participants in care, focusing on safety, focusing on empowering participants to make decisions on their own. So in many ways, all of these, the KEY approach really requires facilitators to, again, collaborate on decision-making with the participants in the program. It's non-directive, non-coercive, non-judgmental, and flexibly implemented. All of that is to say, again, we do provide information to young people, but we are not necessarily insisting or pushing them. We are, of course, encouraging them to participate and stay engaged, but in no way do we expect everyone to complete every assignment. That's not the way we follow. We allow young people to make the decisions on their own. In terms of the approach, we've given you some sense of the approach that we use. How consistent is this approach with, from your perspective, the needs of transition age youth? Very consistent, consistent, neutral, inconsistent, or very inconsistent? Take a quick moment to complete this poll, and then we'll see what y'all have to say. Okay, so the poll is in, and again, the majority of folks see this as either consistent or very consistent with the needs of transition age youth, and there are virtually no one who sees this as inconsistent or very inconsistent. And of course, there is room in the Learning Collaborative to talk about, as we talked about earlier, ways of adapting and thinking through how to continue to develop the product. So folks will, in the learning community, have an opportunity to guide us as well in seeing how this can better meet the needs of transition age youth and how the approaches that we use can better do that. And that, again, is part of the learning community process. And with that said, the learning community, so What is a learning community and why it's important? So a learning community is a network of providers from across New York State, in this case, with a common felt need to change high priority processes and functions and practices with regard to a needed area of service. In this case, the needs of transition age youth in the system. The learning community will partner with the Community Technical Assistance Center. We are your resource team to provide clinical, technical, and social supports to implement the KEY program. But it's also about innovation and problem solving shared by the members of the learning community. So there will also be opportunities to share with each other what the challenges are to implementing, again, what adaptations may come out of the implementation process. And so we'll also be collecting information that is useful to further develop the program. So a learning community is very critical at this point. As I mentioned earlier, we are not testing this in a lab, in an academic institution or a medical institution. We're developing it and implementing it out there in real-world settings. So in many ways, you all are our lab, again in air quotes, because that's where we feel that the most useful implementations can be developed. The expectations of participants in the learning community, so each learning community partner will conduct at least one group. That's all we're asking for, is one key group at the agency or organization. But that also entails participating in the supports provided by the CTEC. So an initial training, 6 hours, with CEs pending approval. And then we will have monthly small group calls. These are essential for continued development and to learn from each other. So monthly small group calls where we'll have an opportunity to talk about implementation challenges and successes. And then we'll have a midterm and final webinar for updates on the project and give folks some feedback on how overall the KEY program is being implemented. And then we have some additional support. So we can set up individual consultation calls as needed to troubleshoot program-specific or site-specific problems that may be coming up, or additional consultation that's needed on issues that may arise. And then we'll also set up a Google chat group to promote exchange among LC participants. It may be exchanging or requesting additional resources or ideas about how to implement or adapt a particular session. So the Google chat group is another support that'll be available to all participants in the learning community. And then one of the expectations is that each participating organization will identify a core implementation team. That core implementation team will be responsible for implementing the program, planning, implementing, and evaluating the impact and value of KEY. And active members of they'll be active members of the regional learning collaborative. That is, core implementation team will interact with other core implementation teams. So when we get on the monthly calls, the core implementation teams will be able to interact with each other. The composition of the core implementation team, again, it sounds like a lot, but really our expectation is at minimum the group facilitators of KEY and their clinical supervisor. Optional and encouraged where possible. We also think that the team could include the program director or senior leadership, a youth advocate or a peer advocate, and other staff who express an interest in learning more about KEY, or others in the community who have resources or interest to provide. So, for example, in the past, we've had a nutritionist come in and join the KEY group when we talk about diet and exercise and healthy lifestyles, or a reproductive health nurse or health specialist to come in and talk about intimate relationships. So others can be brought into the KEY program to deliver the sessions and support the implementation of the program. We believe regular supervision is going to be a critical element leading to the success of KEY. And of course, supervision can address the clinical issues that come up with individual participants, but also the implementation challenges, the ease of use, and the response of participants. So we always believe clinical supervision is a critically important and often missed aspect of implementing new practices. And so a little bit about what we've learned in the past. Most of the data we've collected in the past has been via focus groups and or interviews with facilitators and some participants. So some of the things that we see, these are just some quotes that group facilitators have given us on some of the outcomes related to KEY. So as you can see here, one facilitator said, my one individual was able to recognize how his anxiety was something he had to work on. He was able to recognize coping strategies to deal with his anxiety. So here, the individual, as I mentioned earlier, it's an adjunctive approach. So this was a facilitator who was running a group, but also had in that group one of his individual clients in the group. So he could see that transfer of information from the KEY group to their individual treatment. Another facilitator, a big thing we work on is advocating for self, building up their confidence to advocate for themselves. So you can see here how some of the topics that we discuss actually show up through the reports of facilitators. Building the confidence and advocating, those are two sessions that we address, two areas that we address throughout the KEY Workbook. And this is a very broad statement, but they realized some things about themselves that they didn't know. Again, the self-assessments that we have them complete are designed to do that, are designed to help young people identify those things and think about things that they might not have thought about with regards to any of the topics that we lay out in KEY. And so these are some other statements that group facilitators made with regards to positive outcomes that have to do in many ways with the group model. So the group itself, there is KEY and the information that we provide, but of course, as we all know, groups do provide amazing opportunities for learning, for cohesion, for connecting to others and learning from others. So these are some statements. Elle came to us and did not want to participate. She became committed to the group. It helped her with socialization. Another one, N was an introvert, almost agoraphobic, and he attended program regularly. And the last one, B, is working on quitting smoking that he talked about during the healthy living section. So you could see some individual outcomes that young people were able to come away with. Now, I will say this is from previous learning communities. The last learning community we did not have an opportunity to focus groups, but this is some of the feedback we've gotten from learning communities we've done in the past. So youth responses. The thing that I like about this group was that we had a structure, because I was part of another group that I disliked because everyone just kept jumping from topic to topic. So that is music to our ears. We realize it's a structured approach. Again, not a manualized approach, not cookbook or cookie cutter, but structured. And I think that is very positive feedback given the model that we're implementing. Another one, everyone is involved. There's always something you can say in response to someone's experience or to others' comments. Even if you can't relate to the topic, you can relate to the people in the group. So again, you see the group format being extremely impactful for some young people. Other responses, group activities were fun because it pushed you out of your comfort zone. I felt comfortable with the instructor in the group. I think the KEY program should be longer because I wasn't part of the school program and now it's done. Now I'm looking for another group, something ongoing. So for those of you who might look at KEY in the 26 sessions and be concerned about its length, here you have someone who's actually talking about needing more. And then, so some of the benefits for youth, in summary, it has helped create, and some other quotes and anecdotal information, helped create clear goals for themselves, helped youth to become more inquisitive, to become more autonomous, and to be persistent. Many youth reported receiving individual support in between groups to help complete action steps action steps. And so that's also something that's critically important, is that there is opportunities for and hopefully supports for work going on between sessions and following through on after someone has identified a goal or an action step that they might want to take. The group is beneficial because it prepares you for after the KEY program, what to expect once you're out in the real world. And then reaching goals. Some participants report that they directly related to meeting their goals of applying to vocational schools. So it built my confidence because there were people in the group that also had depression or anxiety. The group facilitators and group participants, all gave me the support I needed. I also wanted to get better. So those are some of the comments, some of the feedback we've gotten from both facilitators and young people who've been a part of KEY. A little bit on requirements for participation, and then I think we should have in plenty of time for Q&A, so hopefully some questions will come up. But some requirements for participation for facilitators or organizations. Of course, the ability to participate in all the learning community activities. Some prior experience running groups. So one of the things we want to be clear about is, as I said, we're going to provide participants, facilitators, with some information about group facilitation skills, a group facilitation model that is, as we mentioned earlier, practical and replicable and easily implementable. But we're not going to be giving folks intensive training on group facilitation in general. So having some experience running groups could be really important. And then, of course, as we mentioned, an implementation team at each of the sites who can guide the implementation and provide ongoing supervision, and then completing the evaluation instruments. So those are some of the requirements that we expect. Just to be clear, all of this, we have an application process. So if you're interested in participating in KEY, there's an application, and we'll tell you how to request the application at the end. But all of this is laid out in the application so that you'll be clear about what the expectations are and what KEY is. So then we also have some requirements for participants. And actually, it's really just two, that they be in the age range that we are looking to address and work with, so 16 to 25-year-olds, those transition age years, and that they currently be receiving mental health services in therapy and or medication management or the combination of the two. And then we will have some performance indicators. Again, all of these are built into either the workbook or the facilitator's guide. So it should be easy to complete these instruments, and we try to make them as brief as possible. But for facilitators, demographic background, professional background, those kinds of indicators. And then we'll have a very brief fidelity check that you can use for each session. We are going to measure attitudes regarding trauma-informed care. So as we mentioned, this is a trauma-informed, or we've tried to make it trauma-informed. We want to assess some of those attitudes. And then your overall satisfaction with the learning community and your perceptions of the KEY program and its effectiveness and impact. And then on the part of participants, we're going to collect some demographic information. We'll collect attendance, but that's going to be reported by facilitators, attrition or discontinuation. And then for each of the participants, we want to get some idea of session-by-session helpfulness. To what degree do they find each of the sessions helpful as we go along? And then our project timeline. So this is laying out a little bit of what you can expect with regards to participation. Today is the informational webinar. If you have colleagues or people in other programs who are interested, the informational webinar is recorded and will be available for anyone who wants to access it, as well as the slides. And then the KEY application will be due by November 8th. And as I said, we'll talk a little bit about how you can access those. In-person trainings, we do have dates the locations are to be determined, but there'll be a training up in Albany on Tuesday, December 3rd. New York City will be Thursday, December 5th. Western region will be Tuesday, December 10th. And in Long Island and Queens, Thursday, December 12th. Those are fairly solid. They may change, but we're pretty certain about the dates. As I said, locations are to be determined. And then we expect or hope that outreach and recruitment should begin in the new year, and groups to begin in February. The groups will run, as I also mentioned, we'll have the monthly consultation calls throughout the project, and they'll begin once groups start, or actually, I'm sorry, they'll begin once recruitment starts. And then we'll have a mid-project webinar, and then sometime around September of next year, groups can begin to terminate, or will be sort of winding down the project. And then in November, December, we'll have a concluding webinar. So just to give folks a sense of how long. I'm actually going to skip this poll question because I think I want to make sure we leave time for question and answers. So very quickly, if you are interested in joining this opportunity and joining this learning community, one thing I want to mention, we are capping the learning community at 20 sites, so please apply quickly and complete the brief application by November 8th, 2019. For questions or more information, you can email me directly. My email is jr4139@nyu.edu. To request an application, it's an online application. You can send an email to Phung Tran at pt58 at nyu.edu, and make sure that you put in the subject line requesting KEY LC application, just so that she can prioritize those and collect those. And I'll just leave this on for a second in case folks need to jot this down. And I guess I want to open it up for Q&A. So questions that have come up during, or questions that you might have now with regards to the learning community and the program?
All right, Jim, we do have a few questions. We can just get started. So the first one is this program for individuals transitioning, or the people serving them, or the care managers? Is this a training just for clinicians?
So if I'm clear, it could be anyone who typically runs groups. It could be a clinician, it could be a care manager, it could be a youth advocate as well. We don't necessarily preclude peer and youth advocates to be involved or to help run the groups. The professional training of the individuals running the groups can be broadly defined, not just the typical clinicians who may be tasked with running groups. Tony, did you have any thoughts about that?
Yeah, I mean, it's whoever the organization deems, responsible for running groups with a theme centered like this, centered the theme around decision making. So we don't kind of decide what that is, but we have developed a training model that doesn't really require like extensive professional education. I will say that. And so, as Jim said, this type of group facilitation model has certainly been used by individuals who are in peer advocacy types of positions, case management positions. Residential counselors have been trained in programs like this. So it's really what the organization identifies in terms of how they view the staff and the tasks that staff are expected to provide. And, of course, the less education or training or experience a person might have, that's where the supervision piece that Dr. Rodriguez mentioned is really important. And that's why we want on the core team where the supervisor and the actual group facilitators are really working together.
Okay. Other questions?
Yeah. So another one is, what is the attrition rate in such an extensive intervention? Have you provided incentives for attendance, and if so, what? How do we maintain attendance amongst such a difficult population?
That's a great question. So the attrition rates in the past, we haven't really, it's sometimes difficult to track, but we, of course, have attrition. We don't necessarily have the numbers. As I said, in this evaluation, we're going to be tracking attrition a little bit more closely. With regards to what kind of incentives, that we leave up to you, and certainly we can discuss that in the training. We can discuss that in the consultation calls. In many ways, your community and your population best, so the incentives certainly can be set up. I will be clear, we wouldn't be able to provide the incentives, but if there are incentives that you can think of for participation and any of the things that you can think of that could increase engagement. One of the other things I wanted to mention is going back to something that I mentioned earlier. We believe very strongly that a pre-group interview is going to be critical to this process. And that is something that we've added, and we're strongly encouraging that each participant in the group be brought in for a pre-group interview to assess their readiness to participate, to assess their interest to participate, and also to assess for other things. Many of you may have noticed, right? It's a curriculum-based model. It is a workbook. Literacy may be an issue. So what we think is critically important is that in those pre-group interviews, sort of preparing for that and discussing that and how to work through that for participants who may have literacy issues. So we believe that pre-group interview is critically important for increasing motivation and preparation and readiness to be in the group. And then beyond that, yes, any incentives, certainly. Of course, many groups and many organizations feed young people. They make sure they have food or snacks at the groups to make sure that that's not an issue, or that's certainly something that can incentivize the groups. But, Tony, you want to say something?
Yeah. This issue of attrition has been plaguing group work for decades. And certainly this is something I've been looking at very, very closely over the years. And there is oftentimes pretty high attrition, but oftentimes that's associated with either kids being assigned to go to groups where they weren't really prepared or engaged in a informed decision-making process. They're often not aware of what is going to be going on in the group. And if the group doesn't have a structure and a theme, then it goes, as one of the comments already identified in the slide, is it can meander all over the place, and no one really likes that. There's a lot of pitfalls with groups, and one of the goals in this group facilitation model is to avoid all of those pitfalls in groups. And the other piece is, when kids feel pressured, or when anyone really feels pressured, if the group facilitator doesn't have a clear kind of sense of where this group is going, doesn't have a framework in mind, those are the kinds of things that are associated with increased attrition. So it isn't as if you can eliminate it, but there are strategies that organizations and people can implement that is going to make it less likely, and that's going to be an area that we're going to be taking a close look at because groups really do add a special experience. The research over 50 years of group work, it does add a special experience which in tandem with individual kind of work can really, really help, especially young people, to kind of go and address some of the developmental challenges. So if you want to take that on, we invite you. We really respect that, and developing the learning community so we can do a lot better at ensuring that the group modality is something that is effective and sustainable and works for the organization, for the group facilitators, as well as to the young people who are involved.
Great. And one last thing with regards to numbers, just in case. The last time we did the learning community, again, it ranged. So there were some groups that had 50% attendance, some that had 80% attendance. So, of course, you can reverse those for your attrition rate. And so, yeah, there were some that dropped out. There were some groups that were able to keep participants in at high rates. It really depended from site to site. As I mentioned, for this evaluation, we want to track that a little bit more closely, and and consider that as part of the an important aspect of the evaluations of this learning community a little bit more closely. I think we let one more.
Yeah, just one more. I think this could help out a lot of people. What costs are involved? What is the cost of the workbook? And would we be able to receive a copy of the workbook so we can learn about what more of each session entails before committing to provide the key group to our clients?
So the cost, I believe, and so this is that we will be able to provide the initial workbook. So we can provide up to 8 to 12 workbooks per group, pre-printed. With nice binding, and as I mentioned, beyond that, beyond the first group, if folks decide to implement and adopt beyond that, they may have to pay for the cost of printing out additional copies of the workbook. But we can make workbooks available. In terms of cost, there will be there's no cost to the training. So when you come to the training, when you attend the training, that will be no cost. If you're a member of the learning community, the training will be provided free of charge, and there may be some cost to getting the CEs for those who want to apply for CEs, and then beyond that, there may be costs that the site decides to take on. So the person who mentioned, or the question that came up earlier about incentives, we believe, and again, Dr. Salerno and I have been working very closely to make sure that the workbook is all you need to run groups. But yes, if you decide to adapt or add, there's always other things that may be that may be costs that you incur, like whatever, butcher paper or big stickies or anything like that you want to add. But those are things that you can decide on your own, and they're not required material as part of the project. Did I get that? What else was there about that phone? Oh, I'm sorry.
No, I'm just saying cost is not going to be a prohibitive factor at all.
Right.
Really should not.
Thank you for the short answer, Tony. Was there something I missed on that phone? If it was cost?
Yeah, someone was asking whether they could receive a copy of the workbook in advance in order to take a look at it before committing. Yes.
So we are. So at this point, the workbook should be a draft, and so we will watermark it draft. If someone is interested in looking at it prior to starting the group, we can make a draft version available, a limited draft version available for folks to take a look at, and then you can contact us and let me know if you need that.
I think one of the things, just to make this practical, is we could send, I think electronically, we could send a sample of the lessons so that you get a sense of how it's organized and some of the key topics that we have. But as Jim mentioned, we keep getting like this feedback in developing the next draft, and that's likely to be not completed before the time of your application. So I think we could send some samples so you get a sense. I think enough information that you can make an informed decision of whether or not this really will make sense for you and the folks that you work with.
Right. Okay, folks, so we are at time. We're a little past time. Thank you for your patience, and thank you for those questions. Again, if anyone has any ongoing questions, they can contact me, contact Fung for an application, and we look forward to hearing from you and launching this project very soon. Take care.
Take care, everybody.